Good evening. I am a nurse, and I've been a nurse for more than 28 years. I don't want to admit that, but it's true. And normally when I give talks of this nature, I really speak about the nursing perspective and what do I do. But I thought for this event, I would speak more about why I do it. As you can imagine, when people ask me, so what do you do? I say, well, I work with women who are pregnant with babies who aren't going to live too long. And they kind of look at me and they're not sure, should they run? Should they cry? Did they really hear me? They're not quite sure why anyone would do that. And I've been asked many times, why do you do that? So for me, let's see. It was a journey. I started out as an adult med-surg nurse, and in my first job at Columbia, I worked on a unit that saw, it was in the middle of the 80s, so full-blown AIDS patients. I had a 32-year-old father of two with biliary cancer, a 54-year-old woman with an invasive cancer. On my second night of orientation, my patient died of a brain tumor, and my preceptor said, gee, Fran, I hope this isn't an indication of how your career is going to go. But actually it was. And it kind of set me on a journey that I realized over time not only changed me as a person, it changed the way I practice my faith even. And I was awakened to the idea that, you know what, it's not about whether you're good or bad. Life just happens. And so where can I fit into this whole picture of life? So why nursing? Well, I had my appendix out when I was 7, and I thought, gee, they seem really nice. They take good care of kids. They wear very cool hats. We don't do that anymore. But I was intrigued, and over time, and actually over this past weekend particularly, I started to really think about that. And so most medical professionals, they want to do good things. They want to take care of people. They want to make a difference. Well, a lot of people do that. Teachers do that. The Girl Scouts do that. So what is it that I wanted to do? And I realized that I actually wanted to touch people. I wanted to have my hands physically on another human being. I wanted to touch them emotionally and psychologically and spiritually. But I really wanted to get my hands dirty. I wanted to do things, dressing changes and vital signs and procedures. I wanted to do all of that. And I didn't run away from it. And again, people would say, oh, so what'd you do today at work? Or what'd you learn today in school? Oh, we learned how to suction. And they're like, okay, I'll talk to you another time. They want to do fun stuff. So what am I looking for? And again, I think this has to do with, I could do a lot of things. Gone to school, I have an education, I'm fairly smart, but I wanted a connection. And I think many people in many professions look for this connection. And the beauty of working in a hospital setting, being a nurse or a doctor, particularly I think for nurses, is that we are there. We are connected. I remember working at night and taking care of patients who were going to have surgery the next day, back when you used to come the night before to get prepped for surgery. And at 6 o'clock in the morning when I would be getting them ready and giving medications, you'd be surprised at how many patients wanted to talk. And a lot of times it was because they were afraid. Sometimes they wanted to confess. Sometimes they just wanted somebody to hear their story. And so I wanted a validation also of myself having this desire, a sense of accomplishment. I wanted it to mean something to somebody and to the world that we live in. And what have I found? I had to really cut this list down because I've found many, many things. But just a few of those things are immense satisfaction. And again, sometimes people will say, you work with dying babies, Fran, really, how can you be satisfied? But there is such a connection to these families, a bond that is established with them and with the families surrounding these babies that you have to kind of see it to believe it. I'm in awe. I'm in awe of the mystery of life. And as much as I know, and as much science as I know, I am always in awe of what I don't know, of how beautiful life is. The miracle is actually that most babies come out perfectly fine, that two cells come together and then divide to become billions and billions of very, very diversified cells, and that it works. That's the miracle. That's the mystery. I have gratitude. I am so grateful that I'm able to do this work, particularly with Dr. PARRAVICINI. I feel very blessed. And I think it keeps me grounded also to recognize the blessings that I have in my own life. I've always tried to treat patients the way I would want to be treated, or I would want my family members to be treated. I have grandparents until their 90s. My mom is still alive. I have grandchildren. I want everyone to be treated well. And so that's another thing that I've seen. Sometimes I have frustration. When things are not done the way they should be done, when you have to work a little harder than perhaps you should, when I have to explain for the 15th time why a mother should be able to keep her baby more than 4 hours after the baby has died. I don't care what the policy book says. It's okay. So those are the frustrations, not the work. It's the extraneous things around it. And where am I going? Well, I hope I'm going to continue to follow these families. I've been drawn to this kind of work from the beginning of my career, so clearly there's something that I gain from it. I think we have to recognize that. We don't do things that we don't feel good about. I want to bear witness to the incredible courage and love and grace that these families have, that I would like to emulate, that I hope rubs off a little bit on me. So there's no thing more important to us than relationship. The connection, we are social beings. We want to be connected to other people. And a hospital setting, in general, can be very cold. It can be very isolating. And for these families who come to us, they've often been told, no, we can't really do that. No, that really won't work. Oh, your baby will suffer terribly if you don't do all of these interventions. And we are here to say, wait a minute. Actually, there are things we can offer. And the fact that you don't choose an intensive medical intervention by no means means that you're doing nothing. Quite the opposite. So what draws me to the bedside of someone who's sick? A desire. I have this desire to do something. I've been out and about, socially, and something will happen to somebody. I'm the first one there. I mean, I don't always know what to do because, I don't do adults anymore. But I want to do something. Even if it's just to hold that person's hand and say, don't worry, we're getting help. I want to get there. I have a desire to connect with them, to ease their pain, to make it better in some way if I can. And I feel that I was called to do this. I can't fight this. This is my vocation. I personally feel I was called to this by God. And I have never been sorry that I chose to be a nurse. Frustrated? Yes. Condition of healthcare as it is today? Not the greatest. But the work, the actual work, the people that I work with, the families that I meet, absolutely. And can I help to save them? And so, as Dr. PARRAVICINI was speaking to, there's a difference between curing and healing. So, definition-wise, curing is recovery from a disease, the remission of signs or symptoms of a disease. And healing is the process of making sound or becoming sound. So you can be cured of a disease and not be healed. And I think this is really forms part of the foundation of our approach. That the healing part of it, we can't fix what is wrong with these babies, but we can heal what's going on within this family. Because they will leave after this child dies, and they will have to live. So what can we give them that will help them live their life? Now, the next slide that I'm going to show you is a couple that we worked with last year whose baby had something called amniotic band sequence. And early on in her pregnancy, her obstetrician was extremely honest with how greatly affected this baby would be. You will not see the baby. But what struck me was that this was a young couple, 19 and 20 years old, And they made the decision very early on that they did not want to terminate this pregnancy, regardless of how affected this child was going to be. And so when they came to us, we talked about what she might look like, what would they like done, what kind of a delivery would be possible, whether it would be vaginal delivery or a cesarean section, and who they wanted to have with them. So they lived far away. We made preparations to have them come in and be induced so that we could be there because we were at as many of the deliveries as possible. And so they did come in and they got mom into labor. But as the day was going by, she started to think about whether or not she would get to see her daughter alive. So she spoke to the OB and they discussed in great detail that at 19 years old for your first pregnancy to start off with a C-section would not be her advice. However, if the mother so chose, she would acquiesce to her decision. The first thing we did was to check the ultrasound to make sure the baby was still alive, and indeed she was. And so their baby was born, and she was quite affected. So she had a cleft in her face, one eye was good, the other eye covered with a lot of skin. She had a normal arm and hand, but she had a huge opening in her abdomen, so all of her chest contents, abdominal contents were exposed. Her legs were normal, her feet were normal. So part of what I have to do in the delivery room is to contain. She also was missing part of her skull. So it was quickly take the baby to the bedside. Mommy hadn't seen her yet, put some gauze, put a hat on her, had a very big diaper that kind of contained all of her abdominal contents and chest contents, wrap her in a blanket, and gave her to the father, who was sitting at the bedside next to Mommy on the OR table. So, again, was there crying? Absolutely there was crying. But you cannot mistake this joy. And part of the joy is she actually has her finger in the baby's hand, and the baby grabbed it. I have another picture where the baby is looking directly at her father. This baby lived for probably 45 minutes. This young couple, this mom is now in nursing school. So again, the point is that from tragedy can come some good. And this is why we do what we do. So an example of our work is Charlie. So Charlie's story is that his mom was a physician, a psychiatrist actually. Dad is a businessman. Mom said, very afraid of blood, please don't let him see anything in the OR. And they have two daughters who are 4 and 6. They had a prenatal diagnosis similar to the one that we just saw with this other baby, of limb-body whole complex. And the parents chose comfort care in light of this diagnosis. Mom was going to have a repeat C-section, and she asked that we be in the OR with the rest of the team. Now, in speaking to the teamwork that has to happen, it's just the two of us, but the OB, they allowed a student nurse, 2 student residents, our fellow, a new fellow, the OB team, which was 4 or 5 of them, the anesthesiologist, his fellow, and 2 circulating nurses. It was like a party. And any of you who've been in an OR know there's not a lot of space. But again, people step up to make things happen for these families. So this is where Mommy got to meet Charlie. And that's the fellow who's holding the baby on Mommy's face. So one of the things we like to do is, as quickly as possible, to put this warm, wet baby against a mother's cheek so that she can feel this child's life. Every one of them starts crying and then smiling. That's Dr. PARRAVICINI. And then this is Daddy. Notice we have him behind the curtain. He cannot see anything. And the mother's mother is the other person in the white bunny suit. So after the baby was with them for a little while, Mom had asked us to take him out of the OR and into our transitional nursery and give him a real bath and put on the clothes that his sisters had chosen for him and wrap him in a blanket that was given to him. So that's me with the glasses. And one of our fellows, Dr. PARRAVICINI, we did a very quick head to toe bath, dressing. He was beautiful. He is still alive at this point. You can see his color is not great, but not bad. And I was glad to be able to bring him into the area, the labor and delivery room, where the rest of the family was. So again, what our labor and delivery crew does is they save a labor and delivery and recovery room for us that is right next to the OR suites. So mom will come from the OR and then be recovered in the labor and delivery room, and the family can visit there. Now, these rooms, we have a lovely view down the Hudson River. And on this day, when I came in the room, I said, "Who wants to hold Charlie?" And the 4-year-old was like, "I do." So I said, "Okay, get on that couch." And the day was overcast and cloudy. And I didn't notice this, but the child life specialist that was in the room did. And she said, "Fran, when you handed Charlie to his sister, the sun came out." And luckily somebody got a picture of it. This family very together, and they celebrated Charlie's birthday. Now, please don't tell anyone that we had lit candles in the room to keep oxygen. No one needs to know that. Secret safe, I know. And they sang happy birthday to him. So mom had to end up recovering in a close watch room because she had some complications after the birth. And again, the L&D team closed, this is a 2-bedded room, they closed the one bed so that this family could have privacy. One of the beautiful things that our child life specialists do are hand and foot molds. And they are 3-dimensional. They use alginate for dental molds. And they capture, the beauty of this stuff is it captures such fine detail. Fingernails, creases. And families have this 3-dimensional memento that they can run their fingers over. We do a lock of hair, we do footprints and handprints. And a mother in the NICU asked me to do a lip print, which I had never done, but I was like, okay, let's give it a shot. And she got the lipstick out, and we were able to pull it off, and it was on this beautiful card that had a lovely saying. So the baby's lip print was on one corner, and then mommy put her lip print on the other corner. So they have this at home. Dr. PARRAVICINI was invited to their house to dinner, and they have it up on the mantle. So I'll just leave you with this. If there ever comes a day when we can't be together, keep me in your heart. I will stay there forever. Winnie the Pooh, a very famous philosopher. Thank you.
So let me just scroll through. Thank you. Thank you so much for giving me the opportunity to speak to you tonight. I'm delighted to be here and really grateful to tell you about my daughter, Maggie. Maggie was born on June 28, 2005, and this past June she would have turned 10. We marked the anniversary by throwing a big party to celebrate her life and to raise money for the Maggie Rose Perinatal Bereavement Program, which we founded in her memory, and as you heard, provides invaluable support to families who experience infant death, stillbirth, or pregnancy loss at any stage. It was a wonderful and meaningful night. We raised almost $30,000 for her program. But as you can imagine, it was also pretty bittersweet. And that was pretty fitting because I've always described the journey that we shared with our Maggie as bittersweet. Thankfully, though, the moments of sweet were so much more potent and so much more lasting than the moments of bitter. I was 22 weeks pregnant and under the very good care of a great doctor at Columbia Presbyterian when an ultrasound revealed a whole host of issues, including a cleft palate and transposition of the great vessels of the heart of our very wanted third child and first daughter. I think the doctors were almost sure that Clayton, my husband, and I were looking at a chromosomal abnormality, and she gently pushed us towards an amnio that would provide more information. I recall feeling so surprised, overwhelmed, and completely blindsided. It isn't what someone expects when they find out they're having a baby. It isn't the story that you typically hear, thank goodness. About 3 days later, at 8 o'clock on a Friday night, it was Good Friday actually, my doctor called to tell me that the amnio had come back positive for trisomy 13. I'd never even heard of that before. an extra chromosome in the 13th place. We actually were expecting and hoping that Maggie had trisomy 21. We figured we could all live with that. At my OB's advice, we met with a geneticist and also an incredible genetic counselor whose name was Ruth Ann Denchi. Ruth Ann was among the most helpful and kind people that we encountered in our entire process. She spent hours answering all our questions and was in fact the one who told me that Maggie was a girl. Having had 2 boys before her, I just expected our third would be a boy as well. And the fact that this eagerly anticipated and very sick baby was a girl could have been among the most heartbreaking bits of information for me. As the oldest of 3 sisters and a very grateful product of an all-girls high school and a women's college, I had always longed for a daughter to raise. I will never forget when Ruth Ann delivered the news with a unique kindness and sensitivity that actually made me feel like my prayers had been answered. I think it was Maya Angelou who said that people don't remember what you say, but they will never forget how you make them feel. And that was the perfect reflection of our exchanges with Ruth Ann. I don't really remember her words, but I do remember that she made me feel the deep respect that she had for our daughter and the abiding compassion that she had for us as well. I will be forever grateful to this woman, what a skilled professional and really a very decent person. After working through all the complexities of trisomy 13, Clayton and I came to the harsh conclusion that the situation didn't really have a lot of complexities. Maggie was surely going to die and there wasn't much that we could do about it. So we spent this next several weeks doing a lot of research about her condition, finding out whether or not her organs could be donated. They couldn't, they were all impacted by her abnormality, and whether she would suffer if she was born alive. In the end, we just realized that carrying Maggie to term was the right choice for our family. We wanted to give our boys, who were 5 and 7 at the time, and ourselves, the chance to know and love this little girl. And we really felt like we owed it to Maggie to let her life play out as it was meant to. At about 3 weeks into the whole thing, I realized the essence of parenting is really just giving your children what they need. Maggie's needs were very different from those of her brothers. The boys needed vaccines, healthy dinners, a safe tan to cross the street, physics tutors, and money for college. She needed the opportunity to make a loving transition from this phase of her life to the next. In carrying her to term, we were able to parent her in the purest sense of the word, and that made it infinitely easier to make peace with her death. We knew we couldn't prevent the situation from being sad, but we were determined not to make it a negative one for us, for the boys, or of course for Maggie. We decided to leave our OB's very good care and have Maggie at a hospital in our northern Westchester town. I will be forever grateful to the doctor, who was kind and respectful enough to share her honest opinion that she wasn't sure we could have had the experience we wanted had we stayed to deliver here. And because we live about an hour from here, I wanted to make sure that our family, especially the boys, were close enough to the hospital so that they could get there quickly after Maggie had been born, because we were pretty sure we wouldn't have a lot of time. Clayton and I were very realistic about Maggie's diagnosis and her prognosis, and so we made the decision to choose comfort care for this very wanted child. We felt like it would optimize her own experience and maximize the quality of the time that we all had together. That said, making a conscious choice to refuse measures that could prolong the life of your precious child seems counterintuitive on absolutely every level. What kind of a parent doesn't fight for the life of their baby? For me, it was really kind of a battle between my head and my heart. I knew intellectually that invasive procedures to prolong Maggie's life just didn't make sense, but the pull towards wanting more time with her was so strong. I still feel thankful for the neonatologist who we were working with, who explained patiently, sensitively, clearly, and repeatedly what the consequences of our various choices were. Having full information made it easier for us to choose this route. Maggie was born at 3 o'clock in the morning on the dot on June 28th at exactly 36 weeks. I delivered by C-section because she was transverse and they were unable to turn her as my water had broken several hours earlier. She weighed 4.5 pounds. Before I had even realized that she had been born, a very kind nurse named Lorraine Owens, who was back from her own maternity leave just one day before, whispered in my ear that she had just baptized Maggie as I had asked. I had been told by others in my situation that we would feel joy when we were finally able to meet our daughter, but I just couldn't imagine it to be true because I knew that once she had been born, the clock on her precious life would begin ticking. And then I met her. And she was perfect and lovely, and I felt extraordinarily grateful that she had hung on long enough to meet us. During the end of my pregnancy, I met with the nurses in the maternity ward of the hospital in which I delivered to explain the situation. On the night she was born, I had the sense that they were all aware of our circumstance and the choices we had made regarding her care. After her birth, the nurses helped us dress her in the clothes that I had brought and passed her off to me and Clayton. A very kind friend with whom we had left the boys brought them to the hospital so they could meet their sister. A forward-thinking nurse gave them each a button that said, "I am a big brother," and that meant the world to them, and to me, actually. Those glimpses of normalcy were like life preservers in the midst of it. When Harry and Charlie first saw Maggie, they cheered, so grateful that she had arrived and delighted that she had held on long enough to meet us. This picture is my favorite one, and it's of that scene. Their arms were raised in victory and celebration. Once they met her, Harry and Charlie surrounded Maggie with genuine love and joy. Charlie was 5 at the time, and he was intent on teaching her her ABCs. He told me that she knew she wouldn't be alive for too long, so he had to take full advantage of the time to teach her all the things big brothers usually teach their little sisters. Maggie spent almost every single moment of her life in the arms of her family, surrounded by laughter, celebration, and a lot of love. We should all be so lucky. As quickly as possible, the medical team took us all from the recovery room to our own private room and let us be together. They popped their head in every once in a while, but mostly they left us alone. We took lots of pictures. Some of them reveal the sorrow of what was to come, but most of them, as you can see, are really lovely. To be honest, though, I found it difficult to look at these photos in the months after her death. They just made me too sad. Sometimes they still make me too sad, but I'm so glad we have them. They are surely among my most cherished possessions. Maggie was in my arms when she died. Clayton had his hands on her and off she went. Her death was so peaceful that we weren't even totally sure she had died until the doctor came in to confirm that there was no heartbeat. I remember telling her it was okay for her to leave us, that we understood that she was too sick to live in this world, and that we felt sure that she knew how much we loved her and that we would see her again. And while I'll never know for certain, I don't think she was in any pain. I think a mother can tell those things, and she really did seem peaceful. Giving your child permission to die is an extraordinary thing, but I felt like it was something that both Maggie and I needed. As parents, we are charged with taking care of our children till they don't need us anymore. And at 7:04 a.m. on June 28th, Maggie didn't need us anymore. We had done our part, and it was her time to go. After her death, Clayton took the boys home. They were tired, they'd been up much of the night, and I think they needed a change of scene. Another one of our wonderful nurses came in and told me I could be with Maggie as long as I wanted to. She helped me take her foot and her handprints in a mold that I had brought with me, and she took off Maggie's clothes so I could keep them in the hospital's little bereavement package. I feel peaceful about that time immediately following her death, with one exception. It occurred to me about 3 days later that I never saw her fanny. I never got to flip her over and see that cute little baby bottom, and I wish I had. But I guess if that's the only thing I wish I had done differently in this whole thing, I'm in pretty good shape. I know that in the medical community, trisomy 13 or another catastrophic condition is referred to as being incompatible with life. And I can tell you that no one who came in contact with my daughter, or her brothers, or her grandparents, or Clayton and me still thinks those words are accurate. Trisomy 13 prevented Maggie from living a long life, but it didn't stop her from having a meaningful and full life, and I think you'd be hard-pressed to find a life so good, so loving, and so worthy. I like to talk about Maggie, to pass along all that she taught us and share a bit of her incredible spirit. When I talk about my daughter, I like people to look beyond her diagnosis and see the person that she was, the goodness that she created, and the legacy that she left behind. She may not be with us physically, but no one can deny her rightful place in our family, our lives, or our hearts. And to be honest, I see much of Maggie's spirit in the very strong and spunky personality of her beloved younger sister Barrett, who was born 20 months after she died. Losing a child is about as miserable as it gets. When a baby dies, it is the complete antithesis of pregnancy. And so it can be beastly hard to know what to do or say or how to act with a family in such deep pain. I feel so grateful to Dr. PARRAVICINI and to Fran and her team, their teams who recognize the value in the life of these little